is Mirte Kuipers, who's going to be talking about disadvantaged young adults. So over to you, Mirte.
Yeah, thank you, Felix. Can you see my screen?
Oh, yes, we can.
Yeah, okay, good. Always good to check. So thanks everyone for being here, and thanks for inviting me. I'm going to talk about a study in which we're mapping the complex system that drives smoking from the perspective of disadvantaged young people. And these are my colleagues, and we've been funded by the Dutch Research Council. So in high-income countries, there is a strong socioeconomic gradient in smoking. And in these two graphs, you see in the Netherlands, educational level is a very strong indicator of smoking. So among adults of 25 to 44 years old, the lowest educational levels there are 57% smokers against 16% among the highly educated groups. And we already see this among 17-year-old adolescents, among whom 33% smoke who are in the last 30 days who are in a vocational training, while those who are enrolled in more academic education are far less likely to smoke. So this is, these inequalities are quite concerning, and even though the Netherlands has been very good at implementing all kinds of new tobacco control policies in the last decade, this has been a persisting problem. And part of this may be explained by what they found in several different systematic reviews, that tobacco control policies in general have been less effective in this group. And this begs the question, are we missing something crucial in the current approach of tobacco control? Perhaps we can ask whether we are addressing determinants of smoking, but not changing the system that drives smoking. So this is where a system science approach may help us to understand, because it's a way to understand behaviors as the result of a complex adaptive system, and therefore how we may change such a system to achieve the outcome that we want. So our goal was to start with what is actually this system that drives smoking, and we wanted to do this from the perspective of vocational students. So we carried out a qualitative study with group and individual interviews, and we included 18 vocational students with smoking experience, and they were enrolled in 1 or 2 year vocational training, for example, to work in retail or work in a bakery. And they all went to school in the Amsterdam area and were 16 to 25 years old. The interview guide was focused on having an in-depth and open conversation about their experiences that related to what causes smoking, according to them. And it was based on the determinants of health model to get all the different levels of influence in there. So the analysis is most like a grounded theory approach, in which we first openly coded the data and then selectively coded it to identify causes of smoking, and then how those causes group together. And after that, we are still in the process of an iterative analysis in which we theoretically code the data, so to identify the causal relationships between factors, and to build the causal loop diagram, which I'll explain later what that is, from these relationships, and also identify feedback loops, which I'll also explain what those are. So yeah, as I said, we're still working on these parts, and this is also why I am now presenting you preliminary results. So keep that in mind, that it may still change. So what is this causal loop diagram? So it is a visual representation of the system that produces a problem or an outcome. And here in the corner, you see a small version of one causal loop diagram from the literature. And so they include different factors, so different words connected with arrows, which indicate causal relationships. And they usually also focus on non-linear relationships. So these are what we call feedback loops, and these may maintain an outcome or even exacerbate an outcome. So we call these balancing or reinforcing feedback loops. And I'll get to that as well in the results. So then the preliminary results. I'll first show you a full picture of the causal loop diagram. And then I'll walk you through each of the parts focusing on feedback loops. So try not to read everything at once. We'll get to it. So this is the full picture. And I first want to point out that the solid arrows are the positive relationships, where the increase in one causes an increase in the other. The dotted lines are negative relationships, and the two stripes at the top mean that there is a sort of delay from one factor to another in that effect. So now I want to go to some of the parts of this model. So I want to start here at the bottom right. Here we can see that, well, of course, friends who are smokers are an important factor in whether a young person starts smoking. But this model gives some more insight in why that might be. So first of all, we see that if friends are smoking, young people have a perception that everyone smokes. And this is also fed by parents who are smokers, seeing smoking in public places, and also in other areas such as films or social media. This makes smoking more acceptable and a feeling of fitting in with the group. In turn, this may also increase the likelihood that people befriend more smokers. And this then may lead to a reinforcing feedback loop where normalization combined with peer pressure may reinforce smoking behavior. Secondly, we also see a different mechanism that has to do with friends who smoke. So friends who smoke, they offer cigarettes, they share their cigarettes, and this becomes a way to socially connect among young people. So they experience this as a social activity. And this in turn also increases the likelihood of befriending more smokers and getting in that social circle. And this I dubbed the social function of smoking, where smoking is seen as something functional in the friendships that young people have. Then I want to go to this top left corner where the yellow dots mostly indicate the psychological parts of the model. So we see that stress has an important role here, and individuals or the participants reported that they experience a lot of stress and even chronic stress due to, for example, adverse home conditions and trauma, but also for mental health. This stress leads to a stress response in many different situations, and that they want to escape from those situations or relax. By smoking, they may feel a relief of their stress, which gives a balancing feedback loop because the smoking is being rewarded. On the other hand, and this is a coping mechanism. Oh yeah, right. So I also want to draw your attention to this variable because even though non-smokers may not have already experienced the sensation of what smoking can do to relieve stress, they have seen it in others. So they know that they have seen their parents, they have seen their friends who experience relaxation when smoking. And this actually combines or links the social mechanisms with the more physiological and psychological mechanisms. Then there may be a more long-term reinforcing feedback loop in which addiction can also cause stress. So even though stress is being relieved when smoking, addiction can also deteriorate the mental health in the long term and increase stress levels. So this would eventually reinforce smoking. Yeah. So lastly, I wanted to point out that even though young people themselves have not literally said this is because I live in certain socioeconomic conditions, we do find that many of the variables that we include in this model are related to socioeconomic disadvantage. For example, parents are more likely to be smokers and adverse home situation. And so the mechanisms that I just described may be exacerbated or partly driven by the socioeconomic conditions. So those are then also the key findings, that there are several psychological and social mechanisms which may be driven or exacerbated by lower socioeconomic position. I think it takes too long to go through all of these, so I'm going to skip it for the sake of time. I wanted to point out that we may be able to find certain leverage points for policy. So that is eventually the goal, to see if we can use such a method to find where should we really take action to change this system. And these can be things that are more directly related to smoking, such as smoke-free public housing, or very low nicotine cigarettes, for example, to take that addiction response away. But it may also be focused more on the social services, such as having a safe home environment, prevention of trauma, and yeah, having better mental health care, for example. So thank you very much. Oh, Felix, you're muted.
Thank you. I did click on it, but my click obviously not working. Thank you very much, Mirte. That was really fascinating, and I'm a big fan of systems mapping, and it's you did an excellent way of introducing us to what is quite a complex approach and clearly a very complex study. Fascinating stuff. So we do have some questions for you. So our first question from a name I can't really pronounce, LF. I'm not sure it's actually a name, but so apologies if I've skimmed over that. So Mirte, this is so interesting. Does it give you some insights into interventions that might be different for these young people? And you touched on this a bit already, but I wonder if you could expand on this.
Yeah. Well, I think it shows, for example, if we look at smoke-free policies in public places, that might be, well, first of all, important to implement, but second, that it depends so much on a person's social environment. And they're not only social, but also the environment in their neighborhood, for example, how many people smoke in their neighborhood. So I think it's important to that the model does show that the people who are close to them have a lot of influence, and this may maintain smoking even though we implement smoke-free policies. So I think there are some ways to understand that sort of mechanism better.
Right, and I think this looking at the whole system approach, all the contributing factors helps to open our eyes to all these additional factors which are often beyond the thoughts of health promotion and health sort of protection approaches. So it's a really interesting insights from your study. So Gera says, really interesting study. How was it to work with these youth? I'm interested in the process of the study. So yeah, that was really interesting. Something came up in my mind as well. What was it like working with these young people and getting the right information from them in order to construct these causal diagrams? Yeah,
thanks. I had to leave this out due to the time it would take, but it was really interesting and good to actually hear it from them, because one other causal loop diagram has been made based on literature and theory, but we really wanted to hear what they thought was going on. So yeah, it was really helpful to really understand them. On the other hand, it was difficult, both practically we first intended to have groups together, but we only managed to get maximum of 3 students in the same room at the same time, even though we invited 20. And it was also during, well, the last bit of COVID, or well, still a bit of COVID times. So I think that didn't help to get them in a physical place together. So we might, yeah. But also they did find it difficult sometimes to really draw causal links between different causes. So they could come up with what their own experiences were, what they saw in friends. They did understand what we asked from them, but they, yeah, eventually, initially we wanted them to really create the loop diagram themselves, but we ended up using mostly what they said to build the diagram ourselves.
And I think you've in part answered Hannah's question, but if you had anything additional to add, maybe you could type that into the Q&A box, because you can sort of type an answer there. And we better move on to Chloe's talk now. But thank you again, really, really fascinating and really good to see a new kind of methodology that's not used that much in our field. So thanks for introducing us to that.